Hello everyone, it is great pleasure to be here. Thank you for having me, for opportunity. No, thank you, more convenient from this place. And I would like to share my knowledge in part of bioregenerative medicine. Especially, I will talk about the cardiac longevity, and I would like to introduce you new players in cardiac senescence, like lipoprotein little a and Klotho protein. Let me remind that all my information in my lecture is intended for education purposes only. And let me introduce myself. I'm Dr. Olha Nishkumai. I'm professor at the European Wellness Biomedical Group, European Wellness Academy, as well as the Internal Medicine Department, National Medical Bogomolets University in Ukraine. I bring over 25 years experience in patient care and medical practice as an internal medicine doctor, cardiologist, and rheumatologist. So let me introduce you my objectives of my lecture. So I will talk today about the mechanism of aging, about the role in vascular senescence lipoprotein little a, and also I will talk about the new players of the senescence like Klotho protein in cardiac calcification. And I also advise you all management algorithms for prevention of cardiac senescence and vascular calcification. So I think in the end of my lecture we will be aware about all this question in my objectives. So our population are getting older, and we can expect a continued rise in age-related diseases in the future. So can we stop aging? This is a main question which bioregenerative medicine deals with. And the main mechanism of senescence you can see in my slide, so it's oxidative stress, immune response or low-grade inflammation, toxic injury, ischemia and hypoxia, mechanical injury, DNA damage, and nutrition deficiency. And all these mechanisms are similar for many age-related diseases like osteoarthritis, heart failure, osteoporosis. We will talk today more and tomorrow more about this age-related disease. Alzheimer's disease, atherosclerosis, fatty liver disease, and many others. But before, in beginning of my lecture, I would like to introduce you my favorite painting and my favorite artist, Gustav Klimt, 3 Ages of Women, because everyone wants to be here in this period of life when we are maximum beauty, healthy, and better happy. And really aging, the biggest mystery of all. And did you know that many age-related diseases are interconnected with a bone condition, with osteoporosis or bone resorption? Osteoporosis is silent epidemic. Why silent, you can ask me? Because no any specific signs of bone deterioration. And we can be aware about the presence of osteoporosis only when first osteoporotic fracture has already occurred. And bone and both men and women can be affected by osteoporosis, but women are more commonly affected than men. But tomorrow we'll speak more about the osteoporosis. But my question is how the vessel senescence, cardiac senescence is associated with osteoporosis and bone health. This is main point. This is a vascular calcification. When calcium pathological deposit in soft tissues, and our vessels becomes more stiffness, and this stiffness leads to ischemia of organs and lead to cerebrovascular disease, chronic kidney disease, coronary artery disease, diabetes mellitus, peripheral artery disease, and many others. So the main focus of this problem is the calcification paradox. When calcium is lost from bone, yet pathological deposit in vessels, in any organs, and leads to the nephrocalcinosis, osteosarcopenia, and this all together increase the morbidity and mortality. The main reason, as I mentioned above, this is a common mechanism. It is the inflammation, it's oxidative stress, apoptosis. But what main reason for this? That this all-together mechanism leads to the changes of endothelial It's cells of vessels, and they become like osteoblasts, so like bone cells. And other osteoblasts, like the cell builders of bone, try to capture the calcium and deposit in bone. So similar process occurs in the vessels. So this is transformed cells become also capture the calcium and deposit in vessels. And main player of this mechanism are osteoprotegerine, fibroblast growth factor, calcium, parathyroid hormone, and Klotho protein. But before we're talking about the some calcification of arteries, we need to be aware about the structure of arteries. This is an intima or inner layer of endothelial cells. This is media or smooth muscle cells and adventitia. So the first type of vascular calcification is calcification of atherosclerotic plaques inside vessels. So it happened in endothelial sites. Next type of calcification is the calcification of media. This is type calcification more character for chronic kidney diseases and for secondary hyperparathyroidism. And third type of calcification is calcification of valves, when calcium is deposited in valves of heart. And main player of this process is lipoprotein a. So cardiovascular disease is number one killer, especially due to atherosclerosis. And common risk factors for atherosclerosis are the also unfit habit, so it's smoking, it's alcohol consumption, it's obesity, diabetes mellitus, genetic predisposition, hypertension, gut microbiome disproportion or dysbiosis, and high level of lipids profiles. So if atherosclerosis is the process of growing atherosclerotic plaques inside vessels, it's narrowing of lumen of vessels, and if it happened in cerebral arteries, it leads to the ischemia of brain or stroke. If it happened in coronary arteries, it leads to the heart attack or ischemic heart disease. So what is the principles of diagnostic? This is first of all the lipid profile level we need to check. Then we can check the intima media by ultrasounds investigation. We check the thickness of intima media. And also we can do CT scan with calculation of coronary calcium scan. And we have the options like invasive procedure angiography. But main reason for atherosclerosis is dyslipidemia. So it's a high level of pro-atherogenic lipids, like very low density lipoprotein, low density protein. This is a common name, non-high density lipoproteins. And low level of anti-atherogenic lipids, like high density lipoprotein. And I will introduce you the new killer. New killer, it's a high level of lipoprotein a. This is a similar structure with a low density lipoprotein, also contains the ApoB lipoprotein, but lipoprotein a has a special tails with 10 types of crinkles, and this has many dangerous effects like pro-atherogenic, so it promotes the atherosclerotic plaques growing. Then pro-thrombotic, the molecule of lipoprotein a very similar with a plasminogen. This is our inner component of fibrinolysis system, which help us to dissolve the thrombus or blood clots. And also high-level lipoprotein a has the pro-inflammatory effect. And this leads to the premature cardiovascular diseases and myocardial infarction, strokes, even when atherosclerosis has a minimal initial stage. Did you know that up to 20% of population even don't know that they have high level of lipoprotein a? Because lipoprotein a is genetic predisposition. And these proteins can rise even since age 5 years old. So what are the common pathological effects of lipoprotein a? It's atherogenic, it's thrombotic because, as I mentioned above, lipoprotein structure little a similar with plasminogen, and they bind with all receptors of plasminogen, and our inner factor of fibrinolysis cannot dissolve this thrombus. This is why we, maybe cardiologists, had this experience that there are some clients had a heart attack or stroke even without atherosclerosis due to high level of lipoprotein a. And also, this lipoprotein a leads to the third type of calcification or calcification of valves. So what are the normal range of lipoprotein a? Less than 75 in nanomole and less than 30 in milligram. But better check in nanomole because the amount of these particles can more predict the future attack compared with a weight like in milligrams. So if we have some option, better to choose the lab test with a nanomole per liter. I would like to talk another very important player in cardiac senescence. This is a Klotho protein, which involved in many progeria syndromes. Have you ever seen a 2 years old looking like an older guy? This is due to low level of Klotho protein. So what does it mean, Klotho protein? Generally, Klotho is a mythological figure and one of the 3 fates of ancient Greek mythology. So the Klotho is known as a spinner, taked with the spinning the threads of human lives, alongside with the lachesis, who measure the length of our life, and with the atropos, who cut our life. So Klotho played a decisive role in the destiny of gods and mortal alike. So Klotho was discovered in 1997 by Dr. Makoto Kuroho and his research team while they were studying genes involved in the aging of mice. So Klotho exists in 2 distinct forms, like membrane bone form and soluble form, and has 3 types like alpha, beta, and gamma. Mostly Klotho is expressed by kidney, but also can be a little expressed by thyroid glands, sinus nodes, and choroid plexus in brain. So what some meaning of Klotho? Klotho protein is the receptor to fibroblast growth factor 23. This fibroblast growth factor 23 is activated of absorption phosphorus and excretion calcium. So in our blood, due to high activity fibroblast growth factor, rising the phosphor level and decrease calcium level. But calcium is very important for functioning many organs. The critical consumption of calcium daily 400 milligram. It's needed for coagulation, for muscle contraction. So if this calcium level a little decreases this critical level of daily consumption, all system of our body includes to restore this calcium. And first of this some mechanism is a secondary hyperthyroidism, including the relation with the fibroblast growth factor and Klotho. Klotho depresses this factor. So normal level Klotho can mitigate the activity of fibroblast growth factor and prevent the vascular calcification, as well as the other positive effect, like inhibit insulin signaling, protect against cardiac hypertrophy, vascular calcification, as I mentioned above, anti-cancer, anti-apoptotic, and protection against neurodegenerative disease like Alzheimer's disease and other. So low Klotho cannot regulate the fibroblast growth factor, and nowadays fibroblast growth factor is accepted like more or early marker for kidney impairment, even more early than cystatin C or creatinine, or as we calculate by cystatin or creatinine GFR. And low-level protein activates the inflammation and also endothelial dysfunction, which leads to the vessels calcification and cardiac fibrosis. Another mechanism of secondary hyperthyroidism and finally the calcification of media is a violation of vitamin D metabolism. So vitamin D, which we consume with product, supplements, or inhalation, it's not final product. Final product is D hormone. Only D hormone can bind with the D hormone receptors and can absorb calcium in intestine. But to achieve this final final products of D hormone, vitamin D should pass two hydroxylation, one in liver and second in kidney, by helping alpha-1 hydroxylase. So if we have kidney impairment, so it cannot, vitamin D cannot reach the final product of D hormone and cannot absorb calcium, and due to decreasing the level of calcium in blood, it activates the parathyroid glands with releasing of parathyroid hormone, and it leads to the secondary hyperthyroidism. This process resorbs the bone, activates this is fibroblast growth factor, resorbs the bone, leads to the osteoporosis, but calcium deposit in vessels and kidney, and leads to the kidney stone disease. So this is process when we have the kidney impairment, in any case, aging or arterial hypertension or diabetes mellitus, leads to decreasing the alpha-1 hydroxylase and decreasing the D hormone. So if we can see low than 60 GFR in our clients, so we need to think about the initial stage of cardiac senescence or calcification of vessels. So kidney impairment mitigates the Klotho level, also decreases the activity of vitamin D, and it leads to the activation of fibroblast growth factor, high level phosphate, and low level calcium. This is all together activates the secondary hyperthyroidism with a bone resorption and vascular calcification. That is why it's very important to maintain all the mechanisms which can maintain the Klotho protein level, because it can help in case of the endothelial dysfunction, vascular calcification, cardiac fibrosis, oxidative stress, renin-angiotensin-aldosterone system activation, and also albuminuria in patient. So what are the mechanisms of cardiac prevention, cardiac senescence, cardiac calcification? First of all, we need to check the category risk of our clients. So we can use the special tools in internet, score, and take into together with a level of lipoprotein little a. So if you receive the green box, it's okay. You can only advise lifestyle modification. But if our clients have the yellow box or red box, so we need to be aware and give more advices in part of the prevention of vascular calcification and cardiovascular events. Of course, it's a lifestyle modification. Of course, many of these risk factors similar for vascular senescence, for osteoporosis. Today and tomorrow we will talk more about the osteoporosis. But of course we need to advise the diet. It's mostly Mediterranean diet with cut of carbohydrates, improve amount of protein in our diet, the unsaturated fatty acid, omega-3, and also the physical activity, at least 150 or 300 minutes a week. But what can we offer for those who cannot afford physical activity? So we have in European Wellness special device. It's enhanced counterpulsation. What is the mechanism of this device? So we need to, I need to mention about the mechanisms of blood circulation. So heart during this in systole push blood to the aorta and improve the microcirculation of inner organs. But heart is supplying during rest of heart, so during diastole. This device is equipped by special cuffs which inflate gradually from distal part to the proximal and push blood additional, so enhance the diastole. And in this stage, this improves the blood circulation of heart. Before systole of heart, because it's strong synchronized with the ECG, this cuff is deflate, so it's decreased peripheral resistance. This is the main aim of treatment, heart failure. This is altogether can induce the growing of angiogenesis and arteriogenesis. So ECP device looks like artificial bypass grafting. And due to improvement of circulation, microcirculation of inner pelvic organs, it confirms the effectiveness in erectile dysfunction in men. And we have own experience treatment patient with cardiac failure and CKD when after even 5 sessions we receive the results improvement in NT-proBNP. This is main marker of heart failure, and also a little, but it's only 5 sessions, a little improvement of GFR from 23 to 28. A general protocol includes the 35 sessions, 5 days a week. Another option is hyperbaric therapy. So hyperbaric, it means by high atmospheric pressure inside hyperbaric, it increases the partial pressure of oxygen. So the oxygen easy to dissolve in all liquids like blood, cerebrospinal fluid or lymph, and activate stem cells, also repair blood vessels and promote new blood vessels growth. And we have the new hyperbaric, which we can provide some intermittent hyperbaric protocol. What does it mean? So this is hyperbaric is supplied by additional mask, oxygen mask, and we propose to do some oxygenation in 20 minutes. Then we ask to remove this mask and oxygenation a little decrease. But this activates the special hypoxia-induced factor, which releases the many growth factors, activates stem cells, sirtuins, and improve the mitochondrial function. Of course, when we talk about the prevention of cardiovascular disease, we need to recommend all together these ways. But what we can offer for those who already had some heart attack or stroke, we have to recommend continued treatment, antiplatelets and lipid-lowering medicine. But some lipid-lowering medicine, like statins, can deactivate through the mevalonate pathway coenzyme Q10. But coenzyme Q10 is essential coenzyme for mitochondrial function. That is why for all our clients who have to continue to take the statins, we need to advise at least 300 milligram coenzyme Q10, because it can regulate and improve the mitochondrial function. Also, we can advise some product like phosphatidylcholine. This is a precursor of acetylcholine, and has a many positive effects because phosphatidylcholine is the main component of cell membranes. This is a precursor of acetylcholine, can improve the neuroplasticity of our brain and also can manage and maintain the lipid profile level, as well as in components of bile can improve the digestion. That is why we have a range of products like Plax X and Alpha Plax, choline alpha serine, and as well as another products which contains omega-3 fatty acid, because meta-analysis confirms that omega-3 fatty acid can decrease not only cardiovascular death, but also death from any cases. That is why we have some product which also contain the omega-3 fatty acid together with the krill oil and coenzyme Q10, as well as the many polyphenols, antioxidants like quercetin, fisetin, myricetin, virsutin. Resveratrol in our products with the telomere activation and VPs of gels advanced formula. What there are some ways to improvement and mitigate the activity of lipoprotein little a. For now, to be honest, this is big challenge because, as you can see, no impact of diet. Statins, bear in mind that it even can rise the lipoprotein little a. What we have the option? This is a lipid lowering medicine, PCSK9 inhibitor, and good news for us, this is a niacin or vitamin B3. Vitamin B3 can normalize the lipid profile as well as estrogen therapy, hormone replacement therapy, especially for women who can take this type of medicine. It's beneficial in part of normalizing level of lipoprotein little a, as well as a lipoprotein apheresis. Only this option for now. I mentioned about the niacin, like the main vitamins in maintaining lipoprotein little a. But niacin is a precursor of nicotinamide dinucleotide. And nicotinamide dinucleotide is a precursor for sirtuins. Sirtuins which mitigate the inflammasoma formation. Inflammasomas activate the dead protein gasdermin, which cause the pores in membrane of cells and leads to the apoptosis. That is why it's very important to maintain level of NAD to improve the functioning of mitochondria. I mentioned about the importance, the sufficient consumption of calcium and normal level consumption at least 1,000 milligram daily. But for those who concerned about the development kidney stone disease, I need to mention that European Association of Urology underlines that calcium should not be restricted unless no special reason for this. And daily requirement calcium is 1,000 or 1,200 milligram daily. Did you know that vitamin D deficiency is associated with cardiovascular diseases? That is why it is also very important to maintain the vitamin D according to our norm. In case if we have the kidney chronic disease in patient with a GFR less than 60, I explained you above that it's all mechanism which mitigate and decrease amount of D hormone of final product of vitamin D and leads to the secondary hyperthyroidism with a vascular calcification and kidney stone disease. That is why it's very important to advise additional alpha-calcidol. It's active form of vitamin D. Also very important the consuming the vitamin K2 because it's protect vascular calcification and help to convertation glutamic to carboglutamic acid and deactivate the special osteokine like osteocalcin which prevent conversion the endotheliocytes to osteoblast-like. So the endotheliocytes cannot capture the calcium in this purpose. That is why many researchers confirm that dietary intake menaquinol is associated with reduced risk of coronary artery disease. That is why we have own product, Immune Wheat, which contains the 5,000 units of vitamin D plus 100 micrograms of vitamin K2. And also, I mentioned how important to maintain the health of our kidney. That is why we advise many polyphenols and antioxidants in our brand Swiss Nature Kidney Health, which contains Euperus, Solidago, Berberry, Uva Ursi. So it's some natural herbal product. And also stem cells, of course. Some research confirms that mesenchymal stem cells can help rejuvenate the endothelial cells of basement membrane of nephrons and tubules, but we should know that mesenchymal stem cells in classification of stem cells is a multipotent stem cells and can be matured only to 5 types of cells: cartilage, bone cells, adipocytes, skeletal and smooth muscle cells, but not direct to adipocytes or pre-endothelial of kidney. That is why it can be used for maintaining the bone health because its direct can be maturated to osteoblast. But for purpose, if you would like to rejuvenate the kidney or heart or vessels, the best option is the unipotent stem cells. This is final stage of differentiation stem cells which can be direct maturated to the special organ stem cells. We have the range of stem cells like alive stem cells, frozen stem cells, and stem cells peptides, mitochondrial organelles, and non-organopeptides. Who else can regulate the process of vascular calcification? This is exosomes. Exosomes is a small microvesicles, extracellular vesicles, which deliver the biological active microRNA, protein, lipids, so they act as a intercommunicator between cells. And also these exosomes, by carrying special type of microRNA, can prevent the vascular calcification. And also, due to this amount and level of microRNA, exosomes can be like early marker of vascular calcification. This is confirmed in many clinical and preclinical trials, the effectiveness of exosome. And we have own product, exosomes derived from mesenchymal stem cells. Also, I mentioned how important to maintain level of Klotho protein to prevent cardiac longevity, to prevent calcification and prolong cardiac longevity. So the Klotho can be increased by the renin-angiotensin aldosterone inhibitors, other components, other pericalcitol, recombinant protein which we have in our company European Wellness, and stem cells and extracellular vesicles. So in conclusion, I need to emphasize that I today mentioned about all main mechanisms of vascular calcification. So we need to advise lifestyle modification, maintaining the lipid profile level, consumption of normal level calcium, vitamin D, K2, and also maintain the level of Klotho protein. And I would like to thank the organizer, and I really proud the opportunity to European Wellness hosting this conference, international conference, in framework of our collaboration European Wellness with a famous Ukrainian university like Bogomolets Medical University, Gerontology Institute, especially with a Ukrainian Association of Osteoporosis. And the results of this collaboration is very fruitful because we already have the many article publication in Scopus journal and also many conference where our report was accepted as a poster presentation, and we visited the SKO 2023, 2024, 2025. We already published our first common book. This is Longevity for Heart, Strategies Against Cardiac Inflammation. We can read more about how to prevent the cardiac senescence. Thank you for your attention, and maybe there are some questions in the end of our conference, yes? Thank you.